Everything you've been told about fixing an L4-5 or an L5-S1 disc bulge is backwards. Now, stretching more isn't the solution. It might actually be what's keeping you in pain. Now, I've worked with over 1,000 patients, and the ones who truly recover from a bulging disc don't focus on flexibility. They also focus on stability. Now, the right movements don't just loosen your back. They teach your body how to protect your spine so your discs can finally heal. And that's what I'm going to show you in this video. Now stay tuned, because I'm going to give you 10 easy to do exercises for an L4-5 disc bulge or an L5-S1 disc bulge. Now, these 5 will strengthen your spine, and the other 5 will gently decompress your spine. Now here's what's unique about this routine. You're going to get them in the exact sequence I use for my patients in the office, and when done consistently, most people will feel real relief within the first few weeks. Now, each one takes just a minute to do and needs no equipment. And if you stay until the end, you're also going to get a free disc relief starter guide. It's a downloadable PDF with all these 10 exercises laid out for you step by step, so you can refer to it whenever you do these exercises on your own. Keep watching. Hi, I'm Dr. Lee. I'm a chiropractor here in San Jose, California. Now, after more than 20 years in practice, I've seen too many people wait too long just to get help or rely on medications just to mask their pain. And they don't even realize how much they're missing out on life until it's too late. Now, that's why I created this channel for people living with neck pain, back pain, disc injuries, sciatica, or even neuropathy, who are tired of quick fixes and are ready to really understand what's causing their pain. Now, here you're going to get safe, non-surgical, science-based solutions to help you relieve your pain, protect your spine, and restore your mobility so that you can start living your life again, not just going through it. Now, I want you to subscribe if you want lasting relief, real results, and the freedom to move without fear. I upload a new video every week. If you've been dealing with a disc bulge or a herniation, you already know how exhausting it can be. One wrong move and the pain flares up again. You've tried stretches, yoga videos, even advice that sounded really promising, but only made things worse. Now, it's frustrating because you're doing everything that you can, but your back still feels weak, tight, and unpredictable. Now, the truth is, most routines online aren't made for disc injuries at all. They're just generic exercises that don't consider how delicate your spine truly is. Now, that's why in this video, I'm going to give you something completely different. It's a series of movements designed specifically for the L4-5 and L5-S1 disc bulges. Now, these are the same exercises that we use here in my clinic, where over 1,000 patients have already improved mobility, reduced pain, and regained confidence in their movement. Each exercise is safe for disc recovery and proven to deliver noticeable relief within the first few weeks when done consistently. Now, follow along, because I'm going to show you exactly how many reps and sets you should do to get the best results. Exercise number 8 is a patient favorite, and you'll see why. Let's get started. We're going to start with exercise number 1, dead bug with heel tap. Okay, so for the first exercise we're going to do, we're going to actually lie down on a table. You can actually go on the floor with a yoga mat. That works as well. And you want to support your head with a pillow as well, okay? So let's go ahead and lie down on the table here. What we're going to do, rest your head on the pillow. Keep your knees slightly bent like this, okay? What we're going to do is you're going to put your knees up like this. So when you're doing this, you're going to find there's going to be a little arch in your back. Naturally, you'll want to arch your back. So with this exercise, we don't want to do that, right? So you want to keep your back as flat as possible. And so you're going to do a little bit of a pelvic tilt. So you're going to tilt your hips up like this. So as you tilt your hips up, you're going to flatten your back. Okay, you want to hold that position. It's almost as if you're doing an abdominal crunch. So you want to keep your abs and your core tight. All right, so you're going to go ahead and do the shift in the hips, keep the back neutral, abs tight, and then you're going to go ahead and bend your knees like this. Okay, so I'm going to show you in 2 parts. So the first part is you're going to do this. I like to put my hands over here so you can kind of feel a little pressure from your back. So you're doing a little pelvic tilt, hold like this, and you're going to drop one knee down, tap, come back up. Drop it down, tap, come back up. So you're gonna do 5 to 10 repetitions. You can do 2 to 3 sets, okay? Just bring it down, tap, keeping the core and everything tight, and then bring it back. The next thing, if you wanna level it up a little bit, have your hands here, and we're gonna do the same thing. You're gonna tap, but as you tap, you're gonna bring this arm back, okay? And then back up like this, and you alternate back and forth like this, okay? And down like that. And that's how you do that exercise. And here's exercise number 2, bird dog with diagonal reach. Now this one is a little bit tricky. You have to really concentrate on keeping your core tight so we don't go into an extension. And let me show you what I mean by that. So what we're gonna do is we're gonna go ahead and get onto, again, table, floor, whatever's comfortable, right? And I'm gonna show you the action of what we're gonna do here. So you're gonna get into a 90-degree angle like this, and the first step is we're gonna do this. Now, if you notice when I do this, what happened to my back? It started to arch, and we don't wanna do that, right? So first thing you wanna do is you wanna keep your core tight. So we're gonna get in this position here, and we're gonna stiffen the back, and we're gonna lock the back in. Now you notice what happened there? My back is nice and stiff and tight. My core is locked in, and at this point, then we're gonna slowly kick the leg and the arm, alternate arm, going back like this, keeping that core and everything locked in and tight, okay? So I don't want you doing this. You see how we're leaning to the side? We don't wanna do that, right? So we wanna keep everything, this is not moving. Once you engage that, it does not move. So go ahead and first step you're gonna do is engage, lock that in, good, and now we're gonna kick the leg and the arm, the opposite leg and arm, forward and back, just like this. And you can go slow with this, you don't have to go fast, okay? So engage, lock, and then kick it forward, bring it back, keep that engaged, forward, kick it back. Now, the next thing is you're gonna do the same thing, and then you're gonna rotate the arms and the legs diagonally out, back in, same thing, out, diagonal, and back in, just like that. Exercise number 3, Pallof press. So in this exercise, you're gonna need a little bit of maybe some rubber tubing. You can get some of these at your sports store or maybe Amazon. These are really good to have just for at-home exercise. But what you're gonna do is you're gonna take one end, wrap it around a handle, maybe the other side of the door, and close the door. And we're gonna step away from the door, holding the rubber tubing like this, okay? And so the action of this is just almost like a chest press. You're just pressing forward like this. Now, as you're doing this, the whole point of this is that you're gonna feel as you're pressing forward, because of the resistance, it's trying to turn your body in towards the door. Okay, so what we're trying to do is resist that rotation. So you're gonna keep core, everything nice and tight. Okay, you can do this in front of a mirror too, so you can get nice, good posture. And then as you're holding this, you're gonna go ahead and press forward, resisting that rotation, and then coming back this way. Okay, so the goal is not how far you can go or how fast you can do it. The goal is to hold this position, core engaged, nice and tight, okay, and then push forward, holding and resisting that rotation, coming back this way. Okay, you're gonna do again 5 to 10 repetitions. To start later on, when you get a little more comfortable with it, you can actually go 10 or 12 repetitions coming through this way, okay? And I would do 3 to 4 sets, all right? You can also then, because of the resistance going this way, turn the opposite direction from the other side and do the same thing. So if you're doing 5 to 10 this way, do 5 to 10 this way, okay? And that's it. Here's exercise number 4, glute bridge. Now, this is actually 3 exercises in one, so I'm gonna show you each exercise as we go through them, because you have to do one followed by the other, and then ending off with the march, okay? Again, pillow to support your neck, just like that. Now, the first part of this exercise is you're gonna do a pelvic tilt, So for those of you who don't know what a pelvic tilt is, as you're lying here in this position, or even with your feet flat, there's going to be a gap here in your back. And that means that your back is in an extension. So I'm going to exaggerate for you, okay? So you see how my back is in an extension? That, for a lot of people, if you have back issues, it's actually going to create some pain. So just simply bending your knees will then take some of that pressure off, and your back will flatten out. So in this position, we need to create some stability as we're going through this motion. So the first thing we're going to do is we're going to engage the core. So two parts of this, you're going to think of your belly button being pressed down into the table, and you're going to use your core to do that, to press and contract your core into the table, flattening out the back. Now as you do that, you're going to notice your hips normally just want to kind of rotate up, okay? So that's the rotation going up, pushing the belly button down into the table. And I like to put my hands here so you can feel your back pressing down on your fingertips. And if you can feel that, that means you're engaging the core and it's actually pushing down. Okay, so that's the first part, pelvic tilt. Remember, pelvic tilt is hips, thrust them forward, flatten the back, push the belly button down into the table, hands right here so you can feel the pressure, okay? So you want to hold this position. Very important that once you attain this position, you hold the position. And once you hold this position, then you're going to go into a bridge. So you're going to push your hips up, creating a straight line. So something like that, okay? Holding this position, all right? So we're going from pelvic tilt into a bridge, and then at the end, then we're going to do some marching in place. Now, if you can only do the pelvic tilt, that's fine. If you can only go into the bridge, that's okay as well, okay? But later on, we do want to see if we can alternate the tapping, because that's going to cause you to contract muscles on one side versus the other as well, okay? So again, pelvic tilt, flatten the back, hold that into a bridge, okay? And then the last part is then you're going to lift one knee up, bring it back down. Lift one knee up, bring it back down. Again, knee up, back down, and then return back to this position, okay? So this one's gonna be a little challenge for some people, and if you can't do it because of the pain, then don't do it, and do a modified version of it where you're actually not lifting up, maybe just doing pelvic tilts by themselves, okay? 5 to 10 repetitions, 2 to 3 sets. Exercise number 5 is wall supported single leg deadlift. Now, classically, if you do have a bulge, a disc herniation, you've got radiculopathy, you probably don't want to be doing heavy squats, deadlifts, because that can really, if you're not doing the proper form, can really cause you to have a flare-up. So an alternative method is to do this modified single leg deadlift, okay? And let me show you how to do it. Now, you can go up against the wall, you can go onto a piece of furniture. I'm just going to use a furniture here for you guys as an example. And so basically, if this was a wall, you just put your hand here to support on the wall. I'm going to use this guy right here. So what we're going to do is, now this is really important, is that when we're doing this motion, you're keeping your core engaged, squeeze in on the glutes, and keep your back as straight as possible while you're going through the motion. And I'm going to show you what I mean by that. Now, this leg here is going to have a slight bend as you're bending your torso forward. And as you bend your torso, you're bending here at the waist, not bending in your back like that, okay? So first thing you're going to do, again, brace up against a wall. I'm going to use this, okay? And this is the leg that's going to bend, okay? What you're going to do is you're going to, again, core engaged, all right? And then you're going to go ahead and squeeze the glutes as you kick this leg back, okay? So you're going to kick the leg back, keeping that tight. Core is engaged. This arm, you're just going to let it drop to the ground, and you're going to slowly bend this knee slightly as you come down, okay? And then come back up like this. And then again, you're going to come all the way down and back up. So again, remember, glutes, core, tight, keep a straight line, bend this knee slightly. Here we go. And 3, 2, 1. And back up. and back up. So you can do those 2 to 10 times on one side, 2 to 10 times on the other side, 2 to 3 repetitions. Exercise number 6, quadruped rock back with a side shift. And so again, you're going to get on all fours on this exercise. And so what you want to do is you want to have your knees kind of shoulder width apart so you have some room for yourself to come back down. You're going to get your tippy toes up like this, so not like that. You want to create a little bit of a tension and stretch here in the calf muscle when you're doing this exercise. So again, going to shoulder width apart and on all fours like this. Now, you want to keep a neutral position in your back. So what's a neutral position? Well, let's go to the two opposites, right? So this is the extreme. That's not good. Then there's this into extension. So you want to go in the middle of the two, which is right there, okay? And you want to hold that position, again, using your core to hold that position, all right? And then you're going to slowly hold that position and then drop your hips down. So the moment that you feel your back arching like this, that's when you stop, okay? That means you've gone too far, all right? So if you're in this position, remember, this is extreme, this is an extreme, right in the middle is good. Hold that position on your tippy toes, and then just slowly rock your hips back. Once you get into the position where you have a nice stretch, then you're going to come back up to the beginning, okay? But again, if you go only up to here and then you start to feel your back rounding, then you want to stop, come back into this position here and start all over again. And remember, get into that neutral position first before you do it, okay? Exercise number 7, seated sciatic nerve glide. So this exercise actually is really useful for if you're having a flare-up and you want to kind of decrease some of that tension on the sciatic nerve. Just to kind of take pressure off of that area, but also to stretch out that sciatic nerve. So what you're going to do is sit on a chair, something like this, okay? You really want to make sure that you're in a nice upright position, okay? So you're not slouching in the chair like this to start off with, because that's already going to create a lot of pressure when you do that. So sit up nice and straight, shoulders rolled back, and the first part of this is just kicking your leg out like that. Okay, so as you kick your leg out, if you feel that, okay, that sciatic nerve is creating more pain, then you want to stop right here. But if you can go all the way, fantastic, all right? And you're just going to pump your leg back and forth like this, okay? That's the first step. Now, the second step is if you're doing this, and you can get up all the way like that, and you're feeling that pressure, what you want to do is you want to point your toes towards your head, and then extend your head back like that. So it's going to look something like this. Okay? So down, up, extending the head back, down, up, extending the head back. You can also sit back onto the chair if that's a little bit more comfortable for you and do the same thing. Again, remember, kick the leg out, head back up, and then down. Up and back down. That's going to allow that sciatic nerve to glide through that groove, stretching it out. You want to do, I would say, 8 to 10 repetitions on each side. If you're only feeling it on the left side of the leg, do only the left side. But of course, if you're feeling both legs, you want to do both legs, 8 to 10 repetitions, 3 to 4 sets. Okay? If it's causing you more pain, you just want to go slow into it. You don't want to push. More is not better, right? And so when you're getting into this position, say for example, you go like this, and right now you're starting to feel that sciatic nerve kind of flare out. What I want you to do is now you can pump your ankle up and down like this. And that's going to allow you to kind of feel how that sciatic nerve is gliding through that area, okay? And as you're pumping the leg up and down, then you're going to find, oh, I can go a little bit more, and then pump. Okay, and then you can go more, and then pump. And then once you can, you go into that full toes pointed up, head back, bring it back down. Up, toes pointed up, head back, and then back down. Okay, and that's a really good stretch to do. If you find relief, fantastic. If you don't and it causes you more pain, then of course, like all exercises, don't do it. Exercise number 8, modified cat-cow with child pose. So same premise here. We're actually gonna go on the floor. We're gonna use the table. I'm gonna use the table for you guys, and this is how we do it. So we're gonna come up over here, and the first movement we're gonna do is we're gonna thrust our hips forward, contracting in on the abs and rounding our spine, okay? So it's hips forward, contracting the abs, and you're gonna hold that position. Then you can do the opposite and let the abdominals fall down, sticking your butt out, head up, and you're gonna contract here in your lower back. Now obviously if you do a contraction like that and that hurts your lower back, don't push into pain, just go just to the point of pain and then back off, okay? So again, first thing you're gonna do is we're gonna thrust our hips forward, contract our abs, round the back, hold, and then drop down, stick the butt out, let the stomach go down, head up, contract onto the lower lumbar spine and hold that position. So you're essentially, what we're doing is we're pumping the lower back discs as we do this. And this is really good because it's creating that segmental motion in the disc, allowing that fluid and nutrient to exchange back and forth. Now, once you get into this position, so those are the first 2 steps. Once you get into this position here, then we're gonna sit back into it, have your arms forward, and then reach and hold that position there. And again, you hold this position, this stretch here for about 20 seconds. Okay, and then you're gonna come back up. So the whole routine is you're gonna do this motion, camel cat, you're gonna do about 10 repetitions. So this would be 1, okay? And you do 10 of those, and then you're gonna go into the child's pose and hold that for 20 seconds. All right, so that's 1 set. You're gonna do 2 to 3 of those sets. Okay, now let's say you're in an office, you're out and about, and you really want to pump that lower back because you're having some pain in that area, and you don't want to get on the floor and start pumping, doing camel cats, and everyone's looking at you going, what the heck's this person doing? What you can do is you can just sit. Okay, sit in this position and just imagine this is the table or the floor in front of you, and you're going to do the exact same. Okay, you're going to thrust back out, so you can do it in this seated position. A lot of the motion is this, and that's going to help to pump that lower back. Okay, so just imagine this is you on all fours, there's the table or the floor on there, and you're doing the exact same thing in that motion. Okay, so obviously it's better to be supported, but in a pinch and you need to do that motion, go ahead and do that seated as well. Exercise number 9, 90-90 hip opener. Okay, so we're almost there. This is the second to last exercise that we're gonna run through. And so what we're gonna do, you can get onto the floor, something like this. I'm gonna show you in 2 different angles, but you wanna have a 90-degree angle here and a 90-degree angle with your back foot. And you're gonna notice if you're really tight, you're gonna be leaning over to this side. So what you want to do is you want to push yourself up so you're sitting over top, because you want to be straight up over this leg here, okay? And the action is going to be bending like this to feel that stretch in here. Now the bend is not going to be happening in your mid back like this, but the bend is happening here in the waist. So as you come down like that. Let me show you from this view. So we're going to do the same thing. Remember, 90-degree angle here, 90-degree angle here. And if you're leaning towards this side, it's because you're tight. So you want to bring this up. So you're sitting straight over top, sit in a nice neutral position. And when you're bending forward, the bend is going to be here in the hips, not like this. See the difference? Here I'm just bending my upper back. I need to bend here at the waist, looking straight that way. Okay? Keep that core engaged, and then bend right here at the waist, and it's coming down like that. Now if this is where you feel the stretch, perfectly fine. Hold that there for about 15 to 20 seconds, and then come on back up. And then do it again, 15 to 20 seconds, and then come back up, okay? So you want to do 3 to 4 sets of these stretches, again, holding 15 to 20 seconds. And really important is you want to bend here at the waist. Now, one more thing that I forgot to mention is when you're actually doing this stretch, it's important to breathe properly. What I mean by that is when you stretch, you want to be breathing out. So before you stretch, take a deep breath in, and then when you go into the stretch, you breathe out. What that does is it raises the diaphragm, creates some space, and allows you to actually stretch forward. But not only that, it causes everything to relax. When you're relaxed, you can stretch. But if you're contracting, it's going to be harder to stretch. Try it without breathing the wrong way and stretch versus breathing the right way, and you'll notice a huge difference. So to recap, you take a deep breath in, and then you're going to blow it out. Once you blow the air on, and you can accentuate that breath, really blow it out so you can hear it. Just like that. And you're going to notice you can actually stretch more. And I want you to do this with every stretch that you do. Breathe in, breathe out, and on the exhale, that's when you do the stretch. All right? And finally, exercise number 10, doorway decompression lean. All right, guys, you're almost there. Last exercise, which is going to help to actually give you a little bit of a decompressive stretch in your back. You can do it inside of a doorway, hold on to a frame. If you have maybe a pole, you can use the pole. I'm just going to use this here on the wall. And all you're going to do, face the door frame, or for my purpose, we're going to use this. And what you're going to do is you're going to hold this, and you're going to slowly bend your knees, and then allow your back to just kind of fall towards the ground with a slight pull right here where you're holding your hands. And that's going to allow this area of your back to slowly just kind of decompress and open up. Okay, so here we go. Nice and gentle with the movement. So you're just going to slowly come down, let the weight of your body pull down, bend your knees, and just hold this position here. Okay, and again, you're going to hold 15, 20 seconds, just like that, and then come on back up. Okay, you can do it again. Let it drop, 15 to 20 seconds, hold, and feel that nice deep stretch in the back. Now, remember we talked about breathing is so important, right? So you're going to do the same thing. Deep breath in, blow it out, and allow every muscle in your body to relax as you allow gravity to work and open up the discs in your back. Hold that right there. Fantastic. So do that. Remember, hold 15, 20 seconds. You can do 2 or 3 repetitions, all the way up to 10 if you'd like. And as often as you can throughout the day, just to kind of take some of that pressure off your back. Great work getting through those exercises. Now, coming up, I'm going to show you exactly how you can get your free disc relief starter guide and why it's worth downloading. Inside, you're going to find all 10 exercises with clear visuals, progressions, and tracking tips to help you stay consistent and see real results. Make sure to come back and watch this video again whenever you feel you need a quick reset or a reminder on proper form. Remember, repetition is what helps your body build lasting strength and stability. Now, I'd love to hear from you. Which exercises gave you the most relief? Was it the seated sciatic nerve glide, or possibly the doorway decompression lean? Go ahead and drop a comment below and let me know. If this video helped you, go ahead and like and share so more people dealing with disc pain can find safe, proven help. And don't forget to subscribe if you want safe, non-surgical, science-based solutions to help you relieve your pain, protect your spine, and restore your mobility so you can start living your life again, not just going through it. Now, I want you to go ahead and check out the link in the description below so that you can get your free disc relief starter guide. So the next video I want you to watch should be this one, somewhere around here, where I'm going to show you exactly how to fix an L4-5, L5-S1 disc bulge without surgery. So go ahead and watch that video next.